So we have a group B streptococcal screening in the mother to prevent the risk of early onset group B streptococcal infection. The swab is usually done at 35 to 36 weeks. The obstetrician reviews the result, and the impact of that will be whether we treat the mother with antibiotics. So nearly 20 to 25% of the mothers have GBS, and so a reasonable number of mothers end up being on antibiotics. And if the mother doesn't receive antibiotics, we treat the baby differently, closer monitoring in a term baby, in a premature baby when we need infection screening as well. We have clear guidelines to support this. The maternal screening that is done antenatally, like hepatitis B screening, for example, if the mother is hepatitis B positive, the baby will need hepatitis B immunoglobulin as well as vaccine at birth. So that's very important result to look at. HIV obviously is not very common here because of the visa regulations, but picking up HIV in the mother is very important to prevent transmission risk. The antenatal maternal screening includes growth scanning as well. So we have to be very looking at the growth parameters. If the baby has abnormal growth, that needs to be looked at. The scan results, including the anomaly screen, very important to look at. If there are any problems that can be picked up, they may suggest abnormalities in the baby that may need intervention after birth. Parents have to be involved at all stages so they know what's the likely impact of each one. Many times, these are transient changes. You don't need to worry them too much. So like single umbilical artery, for example, if the rest of the screening is normal, it doesn't impact on the future health. The growth monitoring and subsequent monitoring is enough. So reassurance is important. Echogenic bowel is fairly frequent. Many times it's a result of a little swallowed blood and which becomes echogenic, but we do need to look at the scan carefully, not pick up other abnormalities. Diabetes status of the mother is important for different reasons. One is to monitor the control, and of course, the better the control, the less impact on the baby. And of course, the risk factor for hypoglycemia is there, so that's another factor that we'll be looking at. And the growth monitoring goes with the scan monitoring as well. So the intrauterine growth is very important for